So welcome back to Real Relief for Sleep, module number 4. And as you know, we're talking about the 8 root causes of poor sleep. And we've talked about the bedroom and the light exposure and diet. And now we're going to move into looking at medications and medications that could be affecting your sleep, as well as nutritional deficiencies. And then I'll throw in a little bit of information about different health conditions that can be impacting your sleep too. So let's start with medications and supplements that could be stopping you from sleeping. So did you know that 40% of adults in the US aged between 20 and 59 years of age use prescription medications? That's pretty huge, isn't it? So I know that many of you listening here will be on a prescription medication. But did you know some of them can actually be impacting your sleep? And it might be a side effect that your doctor hasn't talked to you about. And there's really 6 ways medications can affect your sleep. Firstly, they can reduce melatonin, the hormone of sleep. They can also increase cortisol and stimulation, and this can be like asthma medications or ADHD medications. And others like migraine and headache medication can actually have hidden caffeine in them. So you're doing a really good job keeping off your caffeine, doing what Dr. Janelle told you to do, but your medication might actually have some hidden amounts of caffeine in it. So especially if you're on a headache and migraine medication, look out for that one. Other medications can reduce your REM sleep, so therefore your sleep quality. They can cause leg and muscle cramps, and the cholesterol lowering medications are the ones here that usually cause leg and muscle cramps. They're the statins, so keep aware of that if you're on a cholesterol medication. But also other medications can change neurotransmitter activity, so like acetylcholine activity, and that can cause anxiety and irritation and irritability and poor sleep as well. So we're just going to really go quickly through this, but it's more just like a checklist. So if you're on any medications, use your workbook and go through the checklist to see if any of them could potentially be affecting your sleep. So the ones that can stop you sleeping include heart and blood pressure medications, antidepressants, steroids, cholesterol lowering drugs like statins, Alzheimer's and Parkinson's disease drugs, stimulants for ADHD, asthma medication, opioid pain medications, or any pain medications with caffeine. Same goes for the headache and migraine medication. They can have caffeine in them, as I've said. Some thyroid medications can improve your thyroid, but if you're taking too much of it, it could be overstimulating you and affecting your sleep too. Non-drowsy antihistamines, cold medications and decongestants, weight loss and appetite suppressant products, as well as nicotine patches or tobacco smoking too. So be aware of any products that say that have hidden caffeine or ephedrine in them, or if they claim to give you energy or as a non-drowsy medication, because these are likely to be stimulating you and affecting your sleep. These supplements too that can impact your sleep, and B vitamins are the biggest culprit, okay? Make sure that you're taking them correctly, and that means taking them in the morning because they are stimulatory to you. Vitamin B6 and P5P can impact your sleep because they increase your dreaming. Okay, so if you're taking too much of these, they can give you vivid dreams or even nightmares. So B6 is a really great vitamin for mental health, and it can actually treat anxiety for some people, but for some of my more sensitive clients, it can actually increase their anxiety. So it's a treatment for some and it flares anxiety for others, so be aware of that. The same goes for vitamin B12 and folate, okay? My suggestion is that you practice caution with large amounts. You know, many people are treating their genetic vulnerabilities like MTHFR, and so they've been told to take large doses of these vitamins. They work really well, but for some of us that are really sensitive to supplements, they can actually cause insomnia, okay, and heightened anxiety too. So look at the dosage that you're taking. Anything greater than 500 micrograms could be a problem, okay? And I've seen some people taking 5,000 micrograms of B12, so be careful with that, okay? Be aware that these are found in adrenal support products, mood supporting products, and even just multivitamins. So if you're on any of those, just check the dosage of the vitamin B. Other supplements that can cause issues include licorice root. Okay, it's a herb found in stress formulas, and it's very good at it's very good for supporting the adrenal glands for people that are very fatigued. So it's good for increasing energy, and it increases blood pressure too, but it increases cortisol. And so for some people that might be too stimulatory and it might be affecting your sleep. Now, mitochondrial support or energy formulas can be a problem too, okay? And some of the potential supplements that will be affecting you could be CoQ10, PQQ, D-ribose, L-carnitine, and L-acetylcarnitine. Okay, so my recommendation is that you don't take them in the afternoon or evening because they could be giving you too much energy, and so you can't wind down to sleep. Okay, but I have some other clients that have got chronic fatigue, and I've given them this mitochondrial support, and they're taking it in the morning, but it actually keeps them awake at night. So just be aware that this can be a problem for some people. So if you're on a medication, my recommendation is that you check the packaging insert for the potential side effects and do some research or ask your doctor or your pharmacist. Don't ever stop taking prescription medication without talking to your prescriber, okay? But ask them whether there are any other alternatives that won't impact your sleep. With supplements, you can be a little bit more free and you can stop and start them, I'm sure, because most of them aren't essential. So if you're on a supplement or an over-the-counter drug, stop them all and see if your sleep improves within a week, okay? And if it does improve, add the supplements back in one by one, maybe every 3 to 5 days, so you can identify which one is causing the problem, okay? So, as always, we're going to stop and consider some questions. So my question to you is, are you on any medications or supplements? And could they be impacting your sleep? Remember to get out your workbook and work through these questions as we go, because knowledge is great, but knowledge that is implemented is what's going to change the game for you. Okay, keep in mind we've got that workbook and we've got a medication and supplement checklist that you can go through after this and just check off your medications to see if any of them could be impacting your sleep. Cool, next we're going to go on and talk about some health conditions that are involved in poor sleep. And there's 5 that I want to discuss here: sleep apnea, restless leg syndrome, pain, anxiety and depression, as well as hormonal imbalances. Okay, so sleep apnea is one of the first things that is usually ruled out with someone that is having poor sleep. Okay, it is a serious sleep disorder in which breathing repetitively stops and starts throughout the night. Okay, it affects between 3 and 7% of men and 2 to 5% of women. So it's quite common. And you've got increased risk for sleep apnea if you're overweight, if you have high blood pressure, have a large neck or constricted airways. So just think about those risk factors for a moment. Are you overweight? Do you have high blood pressure? Do you have a large neck or any constricted airways, your nose or in your in your throat. If you said yes to any of that, I would be going and asking your doctor for a sleeping test for sleep apnea. Now, some of the symptoms that you could be experiencing is loud snoring. So it might be your partner that picks these symptoms up, that you stop breathing during the night, during your sleep, and you gasp for air during sleep. You may experience dry mouth in the morning or a headache too, and this is because of lack of oxygen to the brain with the headache, and the dry mouth is just the way that you're breathing and gasping for air. You can have a difficulty staying asleep with sleep apnea, obviously, because once you stop breathing, your body's going to wake you up, and you're going to have daytime sleepiness. So the best thing is to get a sleep test done. And when it's diagnosed, they'll give you, you'll have to buy or purchase a machine called a CPAP machine. And it's a machine that you wear over your face and nose, and it forces you to breathe throughout the night. Okay. The way that you can improve sleep apnea is by weight loss if you are overweight. I'd also be looking into testosterone deficiency for men, because that is very common with sleep apnea. And I would also look into the Batico breathing method to help you strengthen your airways and your breathing, and therefore reverse or prevent deterioration and improve the sleep apnea. Now, the second health condition we're going to look at is restless leg syndrome. Now, you probably know if you've got this, but it's an unpleasant tickling or twitching sensation in the leg muscles when sitting or lying down, and it's relieved only by moving the legs. So it can irritate your sleep, affect you going to sleep and staying asleep a lot at night. And it affects a lot of people, between 7 and 10% of the adult population. So what I want you to do, if you do have this, is rule out a lot of the deficiencies that can cause it. I don't think most people that have this are treated adequately. So you want to go to your doctor and ask them for an iron test, a vitamin B12, a folate, and a vitamin D test, as well as a test for thyroid and ruling out hypothyroidism, because all of these can result in restless leg syndrome. So you want to resolve these deficiencies if present, but the other treatments that can help is using a weighted blanket. And remember, in module number 2, when we talked about your bedroom environment and your blankets, we talked about the weighted blanket and how it's just like a big hug. It's like swaddling a baby, and it swaddles your body and reduces all the all the cortisol, and it calms the nervous system. But it's also good for people with pain issues as well as restless legs. So maybe give that a try. Magnesium supplementation is also helpful for restless legs, and you can take that with capsules, or you can apply it to the legs in a cream, or else you could have some Epsom salt baths. Now, in this module, we're going to be talking about deficiencies in the next section, so we will be talking about magnesium in more detail, but keep an ear out for that if you've got the restless legs. And the same goes for potassium. We're going to be talking about that next, but if you've got restless legs, review that information too and consider supplementation if it's applicable to you. Because the next health issue that can be affecting your sleep is pain. And 20% of adults have chronic pain, and 7.4% of adults have pain that frequently limits their life or work activities. Okay, so it's something that you really want to get on top of if you can. I know that if you've got pain issues, that it's likely that you have been to see a physio or an osteopath or a chiropractic. And if you haven't, I'd highly recommend this. But here's another few functional medicine treatments that you can consider for pain that you may or may not have heard of. So firstly, use magnesium cream or Epsom salt baths, as this can be really helpful for lowering pain and relaxing the body. Also treat a vitamin D deficiency if present, and we're going to talk about that next as well. And it's highly important, okay, because vitamin D supplementation can lower your pain. A supplement that you can use to lower pain signals in the body is MSM. Okay, it literally turns off some of the pain signals. And so the dosage that you can consider is between 1,000 and 2,000 milligrams 2 to 3 times a day. It's quite a high dose. And so what you do is start on a low dose and then increase slowly to see the effective dosage for you, because you don't want to take more than you need. So just start slowly and build it up and see if that reduces your pain. Now, the final thing I want to talk about is red light therapy. Okay, it's basically red lights, and with specific red lights that is at a specific wavelength. Okay, and we also call this low-level laser therapy. And you can go to clinics and they can do low-level laser therapy treatment on the areas of pain. And there's even big machines that are sort of like tanning machines. That's just what they look like, but they envelope your whole body in this red light. And it's very helpful for lowering inflammation and lowering pain. And nowadays you can actually buy lights that you can use at home. And so you can use small ones that are just big enough for, you know, one area of injury, or you can get big big modules that have lots of lights all over them to do full body treatments. And so if you're struggling with pain, that can be a really effective way to reduce the pain and therefore affect and help your sleep. So really consider this. Okay, as we know, people that have anxiety and depression can have poor sleep, and unfortunately it's a real vicious cycle. Anxiety and depression can impact your sleep, but then when you don't get any sleep, it impacts the anxiety and your mood as well. So for our sleep, we want to resolve or treat the depression and anxiety too. And I know that there's a lot of people that have mental health conditions. It's 26% of the population. So I know many of you listening will have that as a concern. Well, I have another course called the Real Relief Foundations Masterclass, and it's a complete course on treating the root causes of anxiety and depression. But during this sleep course, we cover a lot of treatments then that can actually be effective for anxiety and depression too. Okay, so firstly, magnesium, which we're going to discuss next, and potassium and vitamin D as well. Okay, in another module where we talk about stress and hormones, we talk about ashwagandha and GABA, and these are two supplements that are very helpful for anxiety as well. Progesterone cream has been used for hormonal imbalances, but for people that have anxiety and depression that worsens that week or two before a woman's period, progesterone cream can be very helpful for reducing anxiety and depression. So you could consider that and learn about that information. We're going to talk about a few relaxation techniques which help not only sleep but anxiety and depression too. And obviously, if we improve your sleep by following all the recommendations in this course, it's going to have a flow-on effect and impact your anxiety and depression. Remember the weighted blankets too? There was a study that showed that people's anxiety reduced up to 50%. So remember that technique as well. Cool. And finally, hormonal imbalances are a physical health condition that can impact our sleep. And we're going to talk about that further in module number 5. So let's stop again and consider some questions. So firstly, do you have the risk factors and symptoms of sleep apnea? Do you remember those symptoms? Being overweight, having high blood pressure, having a large neck or constricted airways. And some of the symptoms were waking up, gasping for air in the middle of the night, waking through the night, or waking with a dry throat or a headache in the morning. So get your workbook out and work through these questions with me. Do you have restless leg syndrome or ongoing pain? Now, I know I only had one slide on each of these topics, but the information on those slides could be life-changing. They are effective treatments and often overlooked treatments, all right? So go back and study that information, rule out the deficiencies that could be involved, and consider the supplements I've recommended. So now that we've considered medication, supplements, and health conditions, let's move on and talk about the nutritional deficiencies that can interfere with your sleep. So there's three that we're going to talk about: magnesium, potassium, and vitamin D. Now, a lot of people talk about magnesium, and vitamin D is quite well known when it comes to sleep as well, but potassium is one that is very overlooked. I think it's overlooked even in functional medicine circles. So yeah, please listen to these and take this topic seriously, because these deficiencies could be impacting your sleep. Now, magnesium supplementation is essential for anyone with poor sleep or anxiety. Okay, I've put these in big capital letters because it's essential. Okay, everyone with poor sleep and anxiety should be taking a magnesium supplement. Okay, but what is magnesium? Well, it's a mineral and it serves as a cofactor in more than 300 enzymatic reactions in the body. Okay, it has 300 functions in the body. That's crazy, eh? So it's very, very important. It helps with muscle contraction. So if you're all stressed, magnesium can help you. It helps with blood pressure. So again, if you're stressed and you got high blood pressure, it can lower it. It helps with insulin metabolism. But it also helps in the nervous system as well. Helps with nerve transmission, neuromuscular coordination, and it helps make serotonin and melatonin. And we know that the neurotransmitters involved in good mood and sleep. So here's a few symptoms that you might have if you've got a magnesium deficiency. Muscle twitches and cramps, okay? And you know how your eyelid kind of flickers sometimes? That can be a sign of a magnesium deficiency too, okay? Insomnia or poor sleep is an issue with magnesium deficiency, and so is anxiety, depression, and fatigue. As I said, magnesium is involved in blood pressure. So high blood pressure is a symptom of a magnesium deficiency. So is migraines and headaches, okay? As well as osteoporosis, type 2 and type 2 diabetes. So I just want to share a couple of studies here. So they know that magnesium supplementation can help sleep. It reduces the time that it takes to get to sleep by 17 minutes. It increases sleep time by 16 minutes. It's known to increase your melatonin as well as decreasing your stress hormone, your cortisol. Okay, so as I said in module number 1, it was my first tip for sleep to take a magnesium supplement. So please do that. Okay, and magnesium is also helpful for anxiety and depression. And small studies show that 300 milligrams of magnesium can reduce depression in as little as 8 weeks. And magnesium can reduce anxiety in 3 to 6 weeks. And some studies even indicate that the magnesium provides similar effects as lorazepam. If you're not familiar with lorazepam, it's an anti-anxiety medication. It's pretty hardcore. So for magnesium to help, which is natural and safe, If it helps anxiety as much as lorazepam, you know, highly recommended. It's definitely highly recommended. Okay. So there's a few different ways you can improve your magnesium levels. Okay, you can eat lots of vegetables, as I've already recommended. You can have Epsom salt baths. Okay, maybe half a cup to a cup of Epsom salts in your bath, and you can spend 20 minutes in the bath, and that way you're absorbing magnesium through the skin. You should be limiting alcohol and caffeine, as these can strip magnesium from the body. And actually, unfortunately, high stress can impact magnesium levels too. It's like when you're stressed, your magnesium goes down or is stripped from the body. But then when the magnesium's low, you're more stressed and more anxious. And so it's a vicious cycle, really. Okay. But you can eat high magnesium foods such as seeds, nuts, and legumes. And also remember to replace electrolytes after exercise or sauna. So if you sweat a lot, or if you exercise a lot, it's possible that you're losing electrolytes, including magnesium, through the skin. Okay. What I want you to realize, though, is that a lot of people might say, well, can I just get magnesium through my diet? Well, you can probably improve your levels a little bit, but it's actually difficult to get enough magnesium, get the actual recommended daily allowance through your diet. Okay, if the problem is our stores are quite depleted, and a lot of people don't eat magnesium rich foods. Okay, so magnesium rich foods are nuts, seeds, and legumes, you know, and then you get traces in other foods. But so my recommendation is you supplement, right? And the supplementation that you'll need is between 200 and 300 milligrams of elemental magnesium a day. And you want to have them twice a day if you've got restless legs or anxiety. Okay. You can get different forms of magnesium. Okay, magnesium oxide, aspartate, glycinate, citrate, malate. But it's the magnesium glycinate that I recommend for sleep because it's the most calming one. Okay, make sure you avoid the oxide and aspartate forms of magnesium, as these aren't well absorbed, and the aspartate can be quite stimulatory to the body. And I mention these two because they're quite common and they're often in the cheaper formulas. Okay, and so I want you to avoid those. Magnesium is very well tolerated, but if you do have low blood pressure, start on a low dose and ensure that you tolerate the magnesium and that it's not driving your blood pressure even lower. Okay. The main potential side effects of magnesium include a diarrhea or tummy upsets, okay, and that's usually because you're taking too much. Okay, so lower the dose, and if it's still affecting you, check the form of magnesium you're taking, because a magnesium citrate is the worst one for diarrhea effect. Okay, for some people that are constipated, it's a great side effect, but for others, you know, we don't want to have runny poos, do we? Okay, but I know that for some people's tummies are more sensitive than others, so you could always consider transdermal magnesium, so magnesium cream or oils, or as I said, Epsom salt baths are another option for you. Awesome, so now we're going to move on and talk about potassium. Okay, as I said, this is a real overlooked mineral just in the functional medicine industry and definitely in the mainstream medical, but and even I think when it comes to sleep, it's not really acknowledged at all. Okay, but potassium, helps carry electrical signals to cells in the body. Okay, it aids in healthy fluid balance. It regulates muscle contractions, including the heart, and so that's really important for people with palpitations. It helps maintain healthy nerve function, right? It supports the cardiovascular system by lowering blood pressure, and it supports healthy function of the kidneys as well. But did you know that the dietary guidelines for Americas, the 2015 to 2020 version of this, identified potassium as a nutrient of public concern? Okay, it's actually identified as a nutrient of public concern, not because we were eating too much, not because the supplement was toxic or anything like that, but because no one's consuming enough. And I tell you that this is what the data says, that 99% of women and 90% of men don't consume enough potassium. Crazy, eh? Okay, how often have you heard anyone talk about potassium? Maybe they talk about it when it comes to eating a banana. But potassium is really important. And so here's some of the symptoms of low potassium: weakness and fatigue, constipation, heart palpitation, breathing difficulties. So for me, that's really important for people with anxieties, okay? They might be told that it's anxiety. Maybe it's just low potassium. Your heart's pounding away. Breathing difficulties, as I said, muscle cramps or twitching, mood changes and anxiety. Now, low potassium doesn't officially give you insomnia or poor sleep, but this is what I've experienced with many of my clients. So I just wanted to share this overlooked information and vital information with you, considering, as I said, 90% of women and 99% of women and 90% of men don't eat enough of this vital nutrient. So how much potassium should we be eating every day? Well, our ancestors are thought to have consumed 10,000 milligrams a day. The NASEM, which is the National Academy of Science, Engineering and Medicine, recommend between 2,600 and 3,400 milligrams. The World Health Organization recommends 3,500 milligrams, and the Institute of Medicine actually recommend a much higher amount of 4,700 milligrams. I know these are just numbers, but I just wanted to show you the range. There's sort of no agreement, but they do agree that we need higher amounts than people are eating right now. Okay, the average woman, I think, eats 2,300 milligrams of potassium, so much lower than even the lowest recommendation here. So the Institute of Medicine recommend the higher doses because it lowers the risk of high blood pressure, cardiovascular disease, and strokes. Okay, so that's why it's super important. Now, my recommendation is that you calculate your daily intake of potassium. Just write down what you're eating for a couple of days and then go onto the internet and search how much potassium in this, how much potassium in that. Okay, or you can use food trackers and things like FitnessPal, but be aware that anything that comes out of a packet or a bottle will not have potassium levels listed on them. So I just wanted to point out to you how difficult it is, again, to get potassium in our diet, okay? So do you think this is a pretty good diet here? Having a smoothie with banana, spinach, LSA and chia seeds for breakfast, okay? Maybe some protein powder thrown in there. And for lunch, some salad with spinach, tomato, carrots, cucumber and chicken. And then for dinner, they're having some more chicken with some sweet potatoes and broccoli and cauliflower. There's 6 veggies a day and they're having a piece of fruit a day. Do you think this would be pretty good potassium? You think so, because, as they say, you have to eat your bananas because of the potassium, right? Well, get this, I calculated it. And even though on this diet, you'd be eating 6 veggies a day and a piece of fruit, it only gives you 2,022 milligrams of potassium, okay? And remember what we talked about, that you really need at an absolute minimum 2,600, but more likely about 3,500, okay? And the highest recommendation was 4,700. So on this good diet, people aren't even getting half of the recommended level, okay? So that's why so many people have got high blood pressure. That's what I believe why so many people got are stressing out, okay, and got anxiety, because they haven't got enough potassium. So what about if you find that you're struggling to get enough potassium? What could you do? Well, one, you could consider drinking a glass or two of coconut water daily. Okay, coconut water in a glass has got about 600 milligrams of potassium. So drinking two of those will give you 1200 milligrams. So that would pump up your potassium levels a lot. You could consider a potassium supplement, but realize that the capsules of potassium are very low. For some reason, there's some regulatory things around the amount of potassium that you can have in supplements. And so you can only get 99 milligrams in a capsule. Okay, so when you want to supplement with this, you want to use potassium powder instead, and some of the dosages are around 500 milligrams per scoop or per quarter of a teaspoon or something. Okay, and so just sort of in conclusion around potassium, I want you to consider this if you have anxiety, if you have heart palpitations, if you've got restless legs, high blood pressure, muscle cramps, or you find exercise affects your sleep negatively. Okay, maybe you feel wound up after exercising and you can't get to sleep. Then consider potassium. And the thing is, potassium supplements are safe. You can take them. The recommended would be 500 milligrams once or twice daily. I recommend that you monitor your potassium intake before supplementing to ensure you need it. I really only say that because there's sort of a stigma against potassium, okay, and people kind of question you whether if you're actually supplementing. So if you can prove to yourself that you don't have enough potassium in your diet, then you can safely supplement. There are some precautions here. If you are on blood pressure medication or a heart condition, talk to your doctor first about taking it, and probably look at improving your diet first and increasing your potassium levels through your food. Cool. Well, the third deficiency I want to discuss is vitamin D. Okay, and a lot of us will know this as the sun vitamin, because when the sun shines on your skin, your body makes vitamin D. Okay, it's mostly known for its role in bone health, okay, and calcium absorption and osteoporosis, but it's actually important for the immune system, the cardiovascular system, brain development and mood, and it even has anti-cancer effects. So super important. But guess what? Between 35 and 55% of adults worldwide are deficient in vitamin D. Okay, that means you've got a third of a chance, or 50% of a chance, if you're listening here, listening to me, that you've got a deficiency, because I don't. So you must have a high risk of it. But in the US, 41% of white people have a deficiency, whereas 82% of African Americans and 69% of Hispanics have low vitamin D levels. Okay, the thing is, if you've got dark skin, you have a higher risk of a vitamin D deficiency, because your skin's not as efficient at making vitamin D when the sun hits it. Okay, in New Zealand, 48% of adults have a deficiency. I live in New Zealand, so this is why I've got the stats here. But did you know 57% of newborns are also low? Now, this is terrible. It's really going to affect bones and brain and immunity and mood. So super important that we think about this. And here's some of the deficiency symptoms that you may be experiencing. Okay, so there's physical symptoms, so like bone loss and rickets, bone, muscle, and back pain. So this is why I pointed out to anyone that's having issues with pain, think about vitamin D. Also can lead to hair loss, poor wound healing, irritable bowel syndrome, diabetes, and obesity too. Okay. From a mental health perspective, it can lead to fatigue and tiredness, anxiety, depression. There's even some case studies showing that when vitamin D is very low, it can lead to psychosis. It's that important for the brain. Bipolar disorder, dementia, obsessive compulsive disorder. And when it comes to immunity, poor immunity, autoimmune conditions, and cancer too. So I just wanted to show you there's some studies around vitamin D and sleep. And this was done in 20 to 50-year-olds that had a sleep disorder. And when they supplemented with vitamin D, their sleep quality improved by 30%. Their sleep latency, which is the time it takes to get to sleep, reduced by 16 minutes. It's quite significant. And they slept longer. They slept for an extra 40 minutes. And there was also a reduction in the use of sleep medication by 50%. Okay, so even if you just try this one thing, it could really improve your sleep. And as I said, you've got about 35 to 50% risk of it being low. I wanted to point this out for the people with pain. Low vitamin D levels have been associated with increased pain and higher opioid doses, so higher morphine use, higher pain medication use. And supplementation may improve back pain, fibromyalgia, and even cancer pain. So my recommendation for you is get tested for vitamin D. Okay, I've got some letters that I've written specifically for you in the bonus section that you can take to your doctor requesting this test. Okay, and why? So make sure you use those bonuses, I think they're very important and very useful. So I just wanted to give you some recommendations when it comes to vitamin D testing, okay, and therefore and the supplementation that you should use based on the vitamin D test. Okay, so the optimal safe level of vitamin D is 100 to 200 nanomoles per litre. Okay, if you're in America, you'll have different units of measure for your vitamin D, and so that level is 40 to 80 nanograms per mil. So just be aware of what units of measure your test is in. Okay, you have an insufficiency, so this is a mild deficiency of vitamin D if your levels are between 75 and 100 nanomoles per litre, or 30 to 40 nanograms per mil. So if your level is there, the recommended vitamin D supplementation that I recommend is 2,500 international units a day. Okay. You have a deficiency if your test results come back at between 50 and 75 nanomoles per litre, and that is 20 to 30 nanograms per litre. Okay, I'm looking for insufficiencies and deficiencies, not severe deficiencies like your doctor. Okay, so I have different standards here. So I want you, when you get your results back, not just to rely on your GP and what they're telling you is a deficiency or not, because they're only looking for severe deficiencies. I want to make sure that your levels are optimal. So if you find you have a deficiency, you want to be taking 3,750 international units of vitamin D a day. And finally, if you have a severe deficiency, which is less than 50 nanomoles per litre or less than 20 nanograms per mil, then you want to be taking high dose vitamin D, and that's at 5,000 international units a day. Okay. And remember that in our supplement guide, I've given you some recommended supplements for that. Okay. When it comes to vitamin D3, I also recommend that you supplement vitamin K2 along with it. Okay. Vitamin K2 promotes the calcification of bones and prevents the calcification of blood vessels and kidneys. So it really balances vitamin D's role on calcium. Okay, and the recommended daily allowance, or the daily dose, sorry, for vitamin K2 is 100 to 300 micrograms. Okay, but this information is in the supplement guide. These two supplements are well tolerated, so keep that in mind. But, and there's no concern about taking them alongside antidepressant or anti-anxiety medication. But what I want you to do is, if you're taking high doses of vitamin D, which I have recommended, you should be testing your vitamin D levels every 3 to 6 months, okay? Vitamin D is a fat-soluble vitamin, so we don't just pee it out, we store it in the body. And while most of you will be deficient in it, and you'll be checking by blood testing to see if you are or not, We don't want those levels to build up in the body over the long term, okay? Also, here's just a few contraindications for vitamin D and K. So if you're on a cream for psoriasis or on a thiazide diuretic, medications for atrial fibrillation or medications for blood thinning, talk to your doctor, as well as if you've got any liver or kidney or cancers as well. Cool, so we're just going to stop now, take this information in and review. Okay? So my first question is, are you taking magnesium supplementation? Answer that in your workbook. And if you said no, once we finish here, look up that supplement guide and order yourself some magnesium, or go to the health food shop and buy some magnesium. But you need to get it in you. Question number 2, do you have anxiety, heart palpitations, restless legs, high blood pressure, muscle cramps, or find exercise affects your sleep negatively? If you said yes to this question, I want you to highlight again potassium for you. Okay, review your potassium intake and supplement if necessary. And have you been tested for vitamin D recently? As I said, there's between 35 and 50% risk of you having a deficiency, and if you've got dark skin, it's much higher, even up to 80% if it's very dark. Okay, super important. And super important if you don't spend any time in the sun as well, and if you're always indoors. So now we're going to go on to section number 4 of this module, and we're going to have just a little wrap up. So remember to review your answers to the questions to consider that you've got in the workbook there, okay, and that we've gone through today. And that'll highlight the areas in this module that are important to you and to your sleep, okay. So review the medication and supplement list, the lists of medications that can interfere with your sleep, and discuss the options with your GP if there's any alternative medications. Stop supplements temporarily and see if your sleep improves, especially if you're on any energy supplements or supplements with B vitamins. Consider testing or treatment for common health conditions, okay? So the sleep apnea, and also with the restless legs, there are a number of deficiencies that can impact it, okay? Supplement with magnesium, and remember that is essential. That's essential. That's number 1. Don't move on until you supplement with magnesium, okay? That on its own can improve your sleep. Review your potassium levels, or intake, sorry, and test your vitamin D levels. Go and ask your doctor for a test, okay? And remember, we have the resources in your workbook, and in the bonus section we have testing recommendations for your medical doctor. It's just a letter, and just to ask them to consider that. And our supplement guide has recommendations for potassium and for magnesium and for MSM for restless legs as well. No, for pain, yeah. Cool, so finally, this is the questions I want you to think about and answer. Could medications and or supplements be affecting your sleep? Write these in the answer these in the workbook. What testing or supplements can you try to improve the health conditions that you have, if those health conditions are affecting your sleep? And what deficiency symptoms do you have? And are they so these deficiencies likely to be affecting you? And so therefore correction of these, is that going to help you sleep too? So I want you to answer these questions and not move on until you've answered them. But once you have, I'll talk to you in module number 5, and where we discuss hormonal imbalances. I'll see you soon.